This is it, guys. This is the best test you can get from Watson's, Manning's pharmacies online, a glucometer, which you can test your postprandial glucose levels and find out your metabolic risk, find out your cardiometabolic risk. And you can also get one of these continuous glucose monitors, which you can put on your arm to do the same thing continuously for 14 days to really help you understand your risk for cardiometabolic disease. Now, traditionally, what we know that these tests do is look at your glucose levels and say, this is your risk to diabetes. But what we now know is that high postprandial glucose is directly correlated to heart disease and higher coronary calcium scores, which is a direct measure for measuring the atherogenic buildup, plaque buildup in your arteries. So let's look at the current recommendations. The International Diabetes Federation says that your score of 140 mg per dl or lower is a healthy blood sugar level after 2 hours of eating. Between 140 to 200 is impaired blood glucose regulation. And above 200 is where you're diagnosed as diabetic. But when we look at population studies, we find that these scores are way out. So when we look at this study I'm going to share now, it showed that people with no metabolic disease have an average postprandial glucose score of around 99 mg per dl, much lower than that 140. And this study shows that healthy people, 95% of healthy people, have the majority of their postprandial glucose scores between 70 and 140. So if we take an average of that level, let's aim for somewhere around about 110, I would say is a good score postprandial 2 hours after eating is to what you should be aiming for to have a healthy blood sugar level. And remember, keeping your carbs low, getting healthy exercise, getting your sleep, very important, regularly, 7 hours of uninterrupted sleep is really going to help keep your insulin very sweet and very low and keeping your blood sugar low. Now, where's the correlation to coronary calcium scores? So what is this? This is a test you do. You go to a lab, they scan your heart, takes 15 minutes, and you get a report showing your score of calcium. Now, if you have a low score of under 20, very low risk. From 20 to 100, low risk of having buildup of calcium in your arteries. 100 to 300, you've got a moderate buildup of calcium in your arteries and greater risk of having a future heart attack event. Anything over 300 is a severe risk of having a heart attack event very, very soon. And that's when you should be taking immediate action. Okay, guys, so this is a direct reflection of heart disease. Nothing to do with LDL, which has very little reflection. So focus on the calcium score. Now, how is it relevant to the postprandial glucose? Well, we've got a study here I'm going to share with you which shows the calcium score showing a direct correlation to the postprandial glucose, especially with people with type 2 diabetes. And this study done by the Chinese researchers showed exactly the same results, having high postprandial hyperglycemia or high blood glucose associated with high calcium scoring in your arteries. So there's the direct studies showing that association. But why is this happening? Well, when you have blood glucose going through your blood at high levels, it does damage to the hair-like, finger-like projections on the lining of the artery, and that is called your glycocalyx. Now, this glycocalyx is very sensitive to the continuous insults done by high blood sugar. It damages those protein-like projections on the lining of your arteries. And if it's continuous, then it's going to get to the damage to the endothelium, and then you're going to start forming that clot, that tiny blood clot, that tiny plaque formation, which then allows the calcium to come in and stabilize it. And that is the process, guys. And this study showing here, which I'm going to share, shows the loss of endothelial glycocalyx as a result of having this high blood sugar. So guys, what we're going to focus on is using these tests to guide you and help you manage your blood sugar level. Either this test or using a continuous glucose monitor you wear on your arm, and then you can really help yourself get those blood sugars tightly under control. What I'd like to know though is what your glucose levels are. If you've done it with a glucometer or you've done it with a continuous glucose monitor, let us know, let's have a chat and see where we can help you. We'll speak to you next time. Bye for now.